When it comes to treating lung cancer, precision matters. And that's why more oncologists are turning to SABR. Sometimes it's known as SBRT. This is a highly targeted form of radiation therapy that delivers potent doses directly to the tumor while sparing all the surrounding healthy tissue. Dr. Drew Moghanaki, a friend of LCFA and chief of Thoracic Oncology at UCLA Health's Department of Radiation Oncology, will explain how this cutting-edge approach offers new hope to patients who may not be candidates for surgery.
So there's a type of radiation therapy called stereotactic radiotherapy, and there's two different types. One is called stereotactic radiosurgery, and that's used for tumors in the brain, stereotactic radiosurgery. And then whenever you're treating outside of the brain, it's called stereotactic body radiation therapy to distinguish it from the brain. And both of these treatments uses the advanced technology of the machines that we have today with super fast computers driving really elegant software to aim these high precision x-rays to such a small target that you can dial up the amount of treatment to really high doses that can be delivered safely and just go right into the tumor. So that's why the term surgery is used when they're describing radiosurgery. And in fact, when it comes to targets in the brain, we just don't really do that many brain surgeries anymore. Our neurosurgeons work with us. In fact, a neurosurgeon invented stereotactic radiosurgery. And today, many clinics and hospitals will have if a person's lung tumor has gone to their brain, they'll work with the neurosurgeon will work with the radiation oncologist and do radiosurgery. Now, starting around the 1990s, we started to ask the question, can we deliver those same high doses that we can see these tiny targets in the brain to a lung tumor? And it turned out it was technologically a little bit more complicated. Why? Because when it comes to the brain, the skull is a pretty fixed structure. The brain doesn't move much. Might pulsate a little bit with each heartbeat, but it doesn't move, so the target can be small. In the lung, every time a patient takes a breath, the tumor moves. And so how do you deliver that super high dose of radiation or high precision x-rays to this larger target, and is it safe? And what we did is we studied it over multiple decades of studies. Now we're about 30 years in to studying this thing. And it turns out the lung can take these super high doses, and it's allowed us to give more concentrated x-rays in a single session than ever before. And I tell you, when I talk to my patients, I can hear myself talking and I feel like I'm saying something that's almost too good to be true. The fact is, the outcomes are actually seem to be just as good as surgery for these early stage tumors. They annihilate the tumor. They're in place. And what's amazing is the patients don't even really seem to have any side effects most of the time. Every year, I've got a few patients who complain about not having side effects, wondering if their insurance card was run and all they did was lay on a table. It didn't do anything.
If you or someone you love is living with lung cancer, you know that every milestone, could be big or small, takes on much deeper meaning. A birthday, family dinner, maybe even a quiet walk outside, they all matter more. Thanks to breakthroughs in research made possible by organizations like Lung Cancer Foundation of America, there are now more precious moments to look forward to. I recently asked one of LCFA's patient advocates what milestone he was most excited to reach. And with a quiet smile, he said, all of them.
Milestones happen every day when you're a survivor, right? One of the greatest milestones for me in the last 19 years was reaching a point where I didn't think I was going to die tomorrow. But that took about 10 or 12 years, right? So the milestones that I'm hitting now are milestones that are planning for a tomorrow. I just graduated. I just finished a degree at U of M that I've wanted my entire life, but couldn't afford or didn't have the time to go back for, or didn't have the means of some form. But it's a different kind of milestone. So every survivor, depending on where they are either happy to just be here or planning ahead. And they're all milestones and they're all important.